RSV and the RSV vaccine for older adults. Part 1. RSV, the disease. Hi everybody, and welcome to another video from the Farm Easy Tutor. We will continue our discussion on vaccines. This time, we'll go over the RSV vaccine. This lecture series on RSV will be split into two parts. Part 1 will cover the disease of RSV, and Part 2 will go over the RSV vaccine for older adults. What is RSV, and why is it a threat to some people? Respiratory syncytial virus, or RSV, is a common respiratory virus that affects the lungs and airways, making breathing difficult. RSV is a very contagious virus. It's spread through direct contact with the virus, such as from droplets from another person's cough or sneeze, or from touching a contaminated surface. RSV is a respiratory virus that usually causes mild cold-like symptoms. However, RSV can cause serious, severe, and life-threatening infections in older adults and in infants. It can cause severe lower respiratory infections like pneumonia that could lead to hospitalization and death. Who are most prone to get serious RSV infections? In most people, respiratory syncytial virus, or RSV, typically causes mild cold symptoms. However, the virus has the potential to cause more severe infections like bronchiolitis and lower respiratory tract infections like pneumonia. These infections can lead to hospitalization and even death. Older adults and infants are most prone to developing these serious RSV infections. Let's talk a little more about RSV infection in older adults. Each year, the CDC estimates that between 60,000 and 160,000 older adults in the United States are hospitalized, and between 6,000 and 10,000 die due to RSV infection. Adults 65 years and older have an increased risk for severe RSV symptoms and are most vulnerable to developing life-threatening RSV infections such as pneumonia. Adults having underlying health conditions such as chronic cardiovascular disease, chronic lung disease, moderate or severe immune compromise, diabetes with complications, and severe obesity can increase their risk of developing severe RSV infection and hospitalization. How about infants? How does RSV infection affect babies? Babies are susceptible to RSV because their immune systems are not fully formed and their lungs are smaller and not fully developed. RSV is very common in children under 2 years of age, and most who contract RSV experience mild symptoms. By their second birthday, nearly all children in the United States will have been infected with RSV. Older children, teenagers, and most adults have strong immunity from multiple RSV exposures and rarely experience severe infection from RSV. However, RSV is the most common cause of hospitalization for U.S. infants. The CDC estimates that each year, between 58,000 and 80,000 children younger than 5 years of age are hospitalized due to RSV infection, and 100 to 300 die from it. Infants up to 12 months of age, especially those younger than 6 months old, and children who were born prematurely or who have chronic lung or heart disease or a weakened immune system are at an increased risk of developing severe RSV disease. But now there are immunizations aimed at older people, babies, and pregnant women who want to protect their newborns. The RSV vaccine for older people is important because with age, immunity wanes, and they're unable to fight off infections as well as they did when they were younger. Today, we will be focusing our RSV discussion on older adults, not on infants. What are the symptoms of RSV? Initial symptoms of RSV infection are mild and similar to a mild cold. Symptoms are generally isolated to the upper respiratory tract. These symptoms include congestion, runny nose, sneezing, coughing, wheezing, shortness of breath, fever, decrease in appetite, and malaise. Symptoms of an RSV infection usually appear 4 to 6 days after exposure. Symptoms of RSV in adults that require urgent care can include the following: difficulty breathing, dehydration from not drinking necessary fluids, or worsening symptoms. RSV infection. Duration. How long does RSV last? Most people develop symptoms 4 to 6 days after exposure to RSV. In most cases, mild symptoms of an RSV infection usually clear up within a week or two on its own. However, a cough can linger in a mild form for several weeks. Severe cases of RSV may last longer. RSV infection. Transmission. This is the way most of the RSV infections spread. RSV is highly contagious and spreads when someone infected coughs, sneezes, or touches or kisses someone else. It enters the body through the eyes, nose, or mouth. RSV spreads easily through the air on infected respiratory droplets. The virus also passes to others through direct contact, such as when touching a contaminated surface that has the virus on it. The virus can live for hours on hard objects such as countertops, crib rails, and toys. RSV is contagious while the person has symptoms, which is typically 3 to 8 days. RSV may be able to spread a day or two before developing symptoms. RSV infection. Differential diagnosis. How do you know if it's RSV, cold, flu, or COVID? Let's first compare RSV versus the common cold. As you can see in the chart, RSV symptoms are similar to the common cold. However, if wheezing is present, it's more likely RSV, as this symptom isn't as common with a mild cold. RSV symptoms tend to get worse over time, unlike a cold. How about RSV versus the flu? As you can see in the table, symptoms of RSV and the flu may be similar. However, the flu starts with a high fever. RSV usually starts with cold-like symptoms. Also, you're more likely to have body aches and fatigue with the flu, although they're possible with RSV. Diarrhea, nausea, or vomiting is associated with the flu. RSV usually only affects the upper respiratory tract. Finally, let's compare RSV against COVID. As you can see in the chart, the symptoms of RSV and COVID can be alike. However, COVID is more likely to cause difficulty breathing, fatigue, and a sore throat. RSV is more likely to cause wheezing, less common with COVID. Diarrhea, nausea, or vomiting is a sign of COVID. RSV usually only affects the upper respiratory tract. RSV infection. What is the treatment? There isn't a specific treatment for RSV. For those with mild symptoms, no specific treatment is necessary. Once a person is infected, use supportive care to manage symptoms while the infection runs its course. Use over-the-counter medications like acetaminophen or ibuprofen to bring down a fever. Use a cool mist humidifier to help with breathing. Use saline nasal spray or drops to relieve cough and congestion. Maintain hydration by drinking plenty of fluids. And note that antibiotics do not treat RSV. RSV vaccine. Prevention. Why get vaccinated? Older adults, especially those with underlying medical conditions or weakened immune systems, are at a higher risk of developing severe RSV infection, like pneumonia or lower respiratory tract infections. Severe RSV infections can lead to hospitalization and can be life-threatening. Therefore, it is extremely important to take preventative measures like administering the RSV vaccine. Receiving the RSV vaccine helps protect the older adult to reduce their chances of getting a serious RSV infection and to avoid hospitalization. Adults at highest risk for severe RSV disease include older adults, especially those with chronic heart or lung disease, a weakened immune system, certain other chronic medical conditions, or those who live in nursing homes. RSV infections in the older adult can also lead to worsening of existing medical conditions such as asthma, congestive heart failure, and chronic obstructive pulmonary disease. RSV vaccine. Indication. Which adult should get the RSV vaccine? The CDC recommends a single dose of any FDA-licensed RSV vaccine for the following adults: all adults aged 75 years and older, and adults aged 60 to 74 years at increased risk of severe RSV disease, meaning they have certain chronic medical conditions such as lung or heart disease, or they live in nursing homes. What are the chronic medical conditions needed for adults 60 to 74 years old? Well, here's a full list, and it's a long one. The list includes adults having underlying health conditions such as chronic cardiovascular disease, chronic lung disease, especially asthma and COPD, severe renal or liver disease, diabetes with complications, functional disability, severe obesity, moderate or severe immune compromise, and residents in a care home. All of these medical conditions can increase an individual's risk for severe RSV infection and hospitalization. So what are the RSV vaccines that are currently available? There are currently 3 RSV vaccines licensed by the FDA for use in the United States for adults: Arexvy, made by GlaxoSmithKline, Abrysvo by Pfizer, and mResvia by Moderna. The CDC does not have a preferential recommendation for any specific vaccine. It does not recommend one over the other. Summary. In Part 1, we defined what the abbreviation RSV stands for. We described how RSV is transmitted between people. We named the 2 groups of individuals most prone to develop a serious RSV infection. We listed 6 key symptoms of an RSV infection. We outlined the key differences between RSV infection and the common cold, the flu, and COVID-19. And we named the age groups and conditions of older adults that the CDC recommends getting the RSV vaccine. What's up next? In Part 2 of this 2-part series on RSV, we will review all aspects of the 3 commercially available RSV vaccines on the market and compare and contrast their similarities and differences. So stay tuned. Thanks for tuning in to watch this installment of the Farm Easy Tutor. I hope you learned something that you could use at school or in practice. If you would like to continue to see more of these types of tutorials on YouTube, please make sure to click on the black subscribe button below to change it to the word subscribed. Also, if you like this video, I would appreciate it if you can click on the thumbs up icon below to change the color to black. Also, if you have any comments or questions, please feel free to add them in the comments section below or share the site with someone else. Stay tuned to the Farm Easy Tutor channel for more lectures in the upcoming weeks. So until next time, remember to take it easy.